Hi, I'm Dr. Renee Hoenderkamp. I'm a founding member of Together and I'm on the Health Cabinet. I'm a medical writer, a practicing GP and a broadcaster. I wanted to talk to you today about the perilous state that we find our NHS in. We heard from Jeremy Hunt yesterday, who claimed once again that the NHS was the pride of the world. It isn't. Nobody's looking at the NHS from anywhere around the world thinking, I wish we had that health situation in our country. Unfortunately, the NHS is broken, and as a GP, I see the ramifications of that on a daily basis. I see how patients are waiting for months and sometimes years for simple things that would restore them to a functioning daily life, allow them to work and enjoy their life. I can't even tell patients any longer how long they might have to wait. And I'm talking about cataract operations, which are critical for the elderly who can't see and might fall and break a hip. Hip replacements for people that are in agonising pain and can't work. The same for knee replacements. Dermatology for things that to you and I might seem not so important, but they are important. You know, things that affect people's stigma, the stigma that goes with them, their way of life, how they feel about themselves. Mental health services, which are nearly non-existent now for so many things. It's impossible. It's impossible to be a patient, and that's the most important thing. It's impossible to be a doctor within it and be proud. So when we hear from Jeremy Hunt that he's giving yet more billions to the NHS, it doesn't fill me with joy, because the NHS is a massive, bloated beast that is so inefficient that if we could actually just get rid of the inefficiency, get rid of the duplication, the paperwork, the fax machines that they've promised to get rid of 100 times, reform the technology so that doctors could actually learn about their patients wherever they turn up, be it A&E, a new GP practice or anywhere else, then things might start to look up. But none of that will happen, because everything they promised yesterday in the budget, they promised time and time again. They promised to reform tech before and wasted £12 million trying to do it. They promised to get rid of fax machines. There's still 79,000 of them in the system. They promised to get waiting lists down, and now they're going up every week, and we actually have a hidden waiting list, which is so big that the overall list might be 12 million people. So what's gone wrong? The NHS is trying to be too much to too many. We need to have an honest conversation about what we want the NHS to do for us, what we want to spend our taxpayer money on, because it's not government's money, it's our money, and we need to have a say. We need to decide if we want NHS trusts spending money on diversity officers, rainbow crossings and flags. We need to decide exactly what we want treated, and we need to have an honest conversation about that. It's time to say no, this is not acceptable. It's time to actually say that you, as the person who funds the NHS, actually wants a say in how it works. It needs total reform. We need efficiencies. We need to get rid of the waste, and we need to make it patient-centred. We need our doctors and nurses to feel valued when they go to work and enjoy going to work. So that's what Together needs to campaign on, and we need you to campaign with us. So join us now. It's a group of like-minded people who want change for the good, for the betterment of patients. Thank you.